Well, flying abroad for a luxury holiday is commonplace nowadays. Doing so for a hip replacement, not so much. This seems to be changing though, with more and more people opting to have medical procedures done in a foreign country. Finweek looks at the ins and outs of this growing trend. I'm still joined by Tanisizwe and Jessica from Finweek, and with them is Lorraine Melvill, owner of Surgeon and Safari. Roly Buys, Funder Relations and Contracting Executive at Mediclinic South Africa, joins us from our Cape Town studio. Thank you for joining us. Well, Lorraine, can you set out the status quo as it is at the moment when it comes to medical surgeries and the travelling aspect?
I think South Africa really is posed as an ideal destination for what they would now today call health tourism. And Africa is our market. Anything that is a 6-hour flight away from Johannesburg or Cape Town is an ideal destination. The rest of Africa doesn't have specialised healthcare like we do in our private healthcare sector. And as a result, and with the growth in the African markets, with foreign investments moving in, you've got international health insurers. Those patients have to go somewhere, and as a result, South Africa is the perfect destination.
Sorry, Jessica, let me just bring Roly in here and we'll come back to that. Roly, I just want to pick up on the fact that with the rand at current levels, it's going to become all in more popular for medical surgeries. From a Mediclinic perspective, have you already seen this filtering through onto the ground?
Well, yes, we look at not really medical tourism, but to the entire bit of global healthcare that you can consider. And essentially, there's more than just people that come here for Africa. We see people coming for the leisure experience, sports like the Argus and the Cape to Epic and various other such destinations. And then there's the people, like was mentioned, that come from Africa that are being expats that are being moved down here for one or other reason. I think it's very important to stress that South Africa has a high quality healthcare system on one hand, but our prices are actually very competitive. There's a study by the International Federation of Voluntary Health Funds in 2012's prices that just recently was published, and South Africa is the third lowest in comparison to countries like Holland, New Zealand, Australia and US and so on. So we're very favorably positioned to get that kind of business in the long term as well as now in the short term market.
Jessica, I didn't mean to so rudely interrupt you earlier.
No,
Please go ahead.
Apologies. Could you give us a breakdown of what the sort of African segments are coming here for? What are the most popular treatments?
I think the critical health care, so the enormous amount of evacs that are coming out of Africa, which would be your heart attacks, cerebral malarias, versus the elective. But the elective is also a large segment and a growing segment. In other words, elective, something that can, a healthcare procedure that can be planned. They can plan a hip replacement, they can plan hysterectomy, they can. So they are actually both growing markets because the sub-Saharan Africa doesn't really have the specialities that you would get in our private hospital segments.
And which is the sector that's fastest growing? You mentioned cosmetics earlier on when we were chatting. How fast is it really growing?
I don't think our cosmetic market, certainly when I started Surgeon Safari, that was my target market, was the elective, you know, come to Africa, have a safari and etc.
And in the initial stages, who were you targeting? Were you in Europe?
I was targeting the first world economies, and yes, I had enormous, massive growth. But globally, that whole industry changed. All of a sudden, there was competition. You had India. Then we had the economic downturn, so people started to become a little bit homophobic, and they'd rather stay at home. And then there was the great West revenge, so to speak, where they felt the vacuum of their own industry, so they started creating value for money destinations within, for example, America. So people start on, and then America, for example, South America, Panama, those kind of places emerged. So that for us is not a main focus as a market. I think for South Africa, for our health industry, we have to look at medical procedures rather than elective procedures.
You should see business booming. I go back to the weak rand. If we maintain, and a lot of currency strategists are saying that we're going to see a softer rand for longer, it could have a huge impact in a positive way on your company.
It has a huge impact for all of us and all the people involved, because really it's a service. There's a supply chain. You've got health on the one side and you've got tourism on the other side. You know, a patient of health is a client of tourism. When someone's from out of town, they have to stay somewhere, and someone has to take care of them. They need medical concierge services they're not familiar with. So it is a huge growth area.
Roly, I want to come back to the quality of our medical environment, and if you can just again compare that with the international arena, and again if our reputation is well established in the international arena.
Well, I think we do have. Our particular group is accredited by an international based organisation. We also are taking part in health outcomes results. For example, the Vermont-Oxford program that we're taking for neonatal. So there's all sorts of evidence of the quality of the care that we deliver. I do think it's not only the quality, but it's the combination of the value proposition that you have. So you have either good quality and very low cost, or you have a combination of these. And I think it's the fact that we are a value for money proposition which makes people consider this. Just also keep in mind, it's not necessarily people that want to come on tourism here. There's in fact a real need from many of the advanced countries like your UK and Holland and these places where they have fairly long waiting lists for people. For example, the UK have the story where you must have your hip done within 18 months, but it's really just an average. So many people are in fact waiting a very long time for it, and so it becomes almost a necessity for them to move it, you know. So we're actually getting that kind of feedback as well.
Tanisizwe, you've got an issue you'd like to address?
I actually just wanted to add on to what he was saying. I think South Africa is also an innovative country too, especially when it comes to health and medical care and those types of things. I mean, if you look at the companies like Discovery, for example, it has gone on to the US, the UK, and Asia, and sold the Discovery idea, and everyone just bought into it, and it's growing phenomenally. And in terms of the quality of care in South Africa, South Africa is probably the only country in Africa where if a president gets sick, he doesn't fly off to the UK or the US. He gets treated here, and we've also been a training ground.
In fact, in our hospitals, you can find a lot of other countries' presidents.
Absolutely correct. Absolutely,
yeah. Very good scouting ground for journalists.
Good point. Take that as a tip.
And we've also been a training ground for the medical industry worldwide. I mean, I've gone to places overseas, and you walk into a doctor, and he can see. I mean, once it was a doctor from PE. And he could see that I was South African, and he said to me, "Sawubona baba," and I got a shock of my life. In Canada, someone goes "Sawubona baba," and so we had a conversation, and he told me about some association they have there with all the South African doctors. So we've also been a training ground, and I think that also becomes a marketing tool and a marketing factor that we have one of the best quality care in the world.
Are we missing anything from the conclusions in the article?
I'd just like to put this question to you. How strongly are we marketing the country as a medical tourism destination? Are we doing enough? Are we harnessing what we have here?
As a government, no, we're not.
We need to talk to Brand SA.
Yeah, Brand SA. Yes, thank you very much. Brand SA.
I'll give you the numbers
meeting.
on my way out.
That's your next meeting.
No, we're not. Destinations like India, for example, where the governments have gone behind the destination and marketed themselves. Our government, I think, has left it into the hands of the private industry, and it's a very competitive market with our private hospitals, each with their own strategy and their marketing strategy. And it's been a huge challenge for the industry, which really is a supply chain, to get everybody to work together. Because your patient's experience at the end of the day is what will sell yes, they can have good healthcare treatment, but if they have bad follow-up, it's a disadvantage.
Now, I would imagine there would be a number of perceptions of the country that we'd also need to tackle. So crime, political instability, that kind of thing would have to be part of the "this is we're doing okay" kind of message. You'd need to make it attractive on a number of levels. We're
almost out of time, Lorraine. Yeah. I'm going to get Roly to answer that in Cape Town. Roly, are we doing enough in terms of marketing ourselves?
Yeah. I think from a South African point of view, from a country point of view, I think we should be doing more. I think the one word of caution we really have to put on the table is that there's a huge shortage of nurses and doctors and so on in South Africa. And so our capacity, our potential is in many ways also limited. So we need to balance our way going forward. We can't make massive promises that we really can't deliver. But I do think we have a very good name, certainly from a point of view that we have people that fly all over the world for very specific types of care, like hematology or something like that. So I think we have a good name, but we actually need to be building on it in the longer term for a longer term benefit.